Hi everyone and welcome back to another episode on mental health. Today we are going to be diving into something called as adjustment disorder. It's a common experience but one that often gets unnoticed. And I am Dr. Raman Sakhuja, psychiatrist practicing in Cardiff. I make videos about mental and emotional disorders, and through these videos I'm trying to share some easy tips that you can implement in your daily life to improve your overall wellness. Additionally, I also share information about the medical treatments available right here in Cardiff for all these concerns. So, do consider subscribing to my channel. Now, let's start with today's topic. What is adjustment disorder? It is a common experience that often gets unnoticed. So, let's buckle up and let's unpack what it is, why it happens, and how to navigate it. Now, imagine this. Life throws you a curveball. Maybe it's a breakup, a job loss, a major move, or even something positive like a new baby. You feel overwhelmed, stressed, and maybe a little lost. That's normal. But for some people, these feelings become intense and linger on for months, impacting their daily lives. That's where adjustment disorder comes in. Think of it as a temporary glitch in your coping mechanisms. It's your brain's way of saying, whoa, this is a lot to handle. It can manifest in several ways. So let's discuss the symptoms just now. Adjustment disorder can cause a range of emotional and behavioral changes. You might experience being an emotional roller coaster where feeling sad, hopeless, anxious, or angry. You might cry easily or become irritable. You may have social struggles, withdrawing from loved ones, neglecting responsibilities, or having trouble at work or at school. Physical woes include headaches, stomach aches, fatigue, or changes in your sleep pattern or appetite. It is important to remember that everyone reacts differently. The key is that these symptoms are more intense and last longer than what's typically expected for that situation. So, what causes it? Generally speaking, life stressors are the main culprit. There is no single cause, but some common triggers commonly include life transitions like starting a new job, moving, getting married, or having a child. There may be loss like death of a loved one, a breakup, or someone passing away, maybe even pets. Traumas such as car accidents or a violent crime or natural disasters. Then there may be health issues like dealing with your own illnesses or loved ones, health struggles, or maybe having some major surgeries. But also remember that bereavement after having lost someone is not considered specifically an adjustment disorder. In bereavement, we all go through certain stages of grief. It is only when that grief becomes pathological or prolonged that is when we start thinking of it as a disorder. So, moving on. Now, since the symptoms are varied, there can be different types of adjustment disorders. There are actually 6 different subtypes depending on the most prominent symptoms that people may have. It may be with depressed mood where you're feeling hopeless and sad. It may be with anxiety where you may experience excessive worry and nervousness. There may be a mixture of anxiety and depressed mood or a combination of both with disturbance of conduct. And in this, what we see is difficulties in controlling your emotions and engaging in risky behaviors. There may be some with physical disturbance where predominantly physical symptoms like headaches and fatigue are seen. And then the last category may be an unspecified one where symptoms don't clearly fall neatly into another category. Is that confusing? So, let's see how to navigate through the road to the recovery. Here's a good part. Adjustment disorder is temporary. With the right support, you can bounce back and adjust to your new normal. Here's what you can do. First of all, seek professional help. Talking to a therapist can equip you with coping mechanisms and help you process your emotions. Learn to be your own support system. Talk to friends, go and speak with family, or to a trusted confidant. Feeling connected can make a big difference. Then practice self-care, prioritize healthy sleep, have nutritious meals, and take some regular exercise. Relaxation techniques like yoga, meditation can also be helpful. Develop healthy coping mechanisms. Journaling might help. Spend time in nature or pursuing some hobbies that you enjoy can all be part of road to the recovery. Now, my message for those dealing with this condition, that is adjustment disorder, is that it can be a normal response to difficult situations, but when we think of a disorder, that is the case when it is much more prolonged for different people. But by recognizing the signs, seeking help, and taking care of yourself, you can navigate this challenge and emerge much more stronger. And again, if you've liked this video, press that bell button icon, subscribe, comment with your questions below, and do not forget to click on that bell button icon so that you receive all the notifications for the upcoming videos on this channel. And thank you very much for watching.